Well, maybe you've seen the commercials or someone has stopped by your house. Volunteers across the country are making a final push to enroll people in the Affordable Care Act health exchanges. The March 31st deadline has been extended for people who've made a good faith effort to sign up. People will now have until about the middle of April to file an extension. As Josh and Lynn reports, the reality is beginning to set in for some Hoosiers. Get insurance or be prepared to face fines.
Charlie Schleicher is the only full-time employee at Spa, a downtown Bloomington purveyor of manicures, massages, and facials. The spa's owner promoted Schleicher from part-time a little over a year ago, which meant more pay, more hours, but no health benefits.
We at one point met with an insurance agent, and it was just sort of overwhelming and not very clear and very expensive.
Enter the Affordable Care Act. Owner Donna Lafferty thought this just may be a solution.
My husband and I shopped for it for ourselves, so we have the same plan. So then we said, hey Charlie, this is great. Why don't you check this plan out? She did.
The solution is Schleicher signs up for an individual plan on the Federal Health Care Exchange, and the spa reimburses her for it.
Because she's wonderful, and we want to keep her, and we want to make her happy, and it's important that she not risk everything if she gets sick or something, you know, I mean, if something, God forbid, were to happen, you know, no health insurance at all, you know, how does she pay for hospitalization? How does she pay for doctor's visits?
The Laffertys are shelling out hundreds of dollars a month, and they're really doing it out of the goodness of their hearts. They're exempt from having to provide health care to their employees since Schleicher is their only full-time worker. Indiana University health policy professor Kosali Simon says she expects to see more creative arrangements like this among small businesses.
So for small employers, hiring workers who earlier they would have had trouble providing health insurance to, now the Affordable Care Act means these workers have alternative sources, so they could pay them more.
Schleicher also represents the coveted demographic sought after by insurers, young and healthy. The thinking goes that young adults like these college students will help stabilize the risk pool and enable insurers to cover older and more expensive adults. Unfortunately, fewer young adults have been signing up for the health care exchanges than anticipated. Data from the Department of Health and Human Services released in March shows only 23% of Hoosiers who've signed up for insurance are between 18 and 34 years old.
You get that attitude where people don't think that they need it, and you kind of talk to them about these different things that could happen, and a lot of people are very positive about it and they think it's a great idea.
A Kaiser Family Foundation study sounded a note of optimism. The study predicted premium increases of only 1 or 2%, well outside of the risk for the premium death spiral predicted by critics. The study's authors say it's because the emphasis on young adults is less important than the emphasis on healthy individuals overall, and there are government subsidies to take some of the sting out for insurers. Meanwhile, almost 65,000 Hoosiers have signed up in Indiana out of the 145,000 who are eligible. The penalty for remaining uninsured is 1% of your yearly income, or $95, whichever is higher. $95 in 1 year doesn't sound much compared to paying $4,500 or more on a healthcare plan, but you're not getting anything for your money. And uninsured individuals are still responsible for 100% of their medical costs.
When the employer fines start being collected too, you may see more people actually being insured compared to those currently being insured coming in from other sources of insurance.
Simon says after the deadline passes, the emphasis will shift to documenting the experiences of people with the individual plans. If the experiences are mostly positive, then more young people may sign up based on what they're hearing from friends and neighbors, and insurers will lower premiums for 2015, or the opposite could happen. The context around the ACA enrollment numbers in Indiana is important. David Meyer joins us now. He heads a volunteer group that works to educate folks on the exchanges. Hi, David. Thank you for being here.
Thank you, Joe.
You know, there still, though, seems to be some confusion. And whether it's the name of Affordable Care Act or Obamacare or all the politics that kind of go into it, what are you seeing when you're talking with people? What's that confusion coming from?
Well, I think the Obamacare title is stuck as kind of the political title for many of the folks that are opposed to the law, who philosophically disagree with it. And the Affordable Care Act is, of course, the shorter version of its actual name. It's the Patient Protection and Affordable Care Act. And so we often talk to people who are very enthusiastic about hearing about the Affordable Care Act, and then they may actually get up and walk away if when they hear that it's the same thing as Obamacare. So, so it's very confusing. So we try to stay out of the politics and just talk about how the new law can help people in their situation.
And you're still seeing a lot of people coming in for help.
Oh yeah, lots of people. Everyone's a procrastinator, so the last minute. I understand that it sounds like they signed up 1 million people just in the last week, and I understand they're doing more than 1 million website hits a day, and they're at peak volumes on the 800 line for people who are signing up by phone.
Sure, but it still seems like overall those enrollment numbers are going to be lower than projected.
Yeah, I'm not sure. They might catch up because they're pretty close right now. 6 million was the number that they've reached about 24 hours ago, and the original number was 7 million. So it's hard to know with that partial extension that they have whether they'll actually hit it or not.
And year 2 is really going to be the real test, because that's when the fines come and some non-emergency medical services could be denied.
That's right. Actually, one of the challenges we face in terms of public understanding of kind of the consequences of not obtaining insurance coverage is that the penalty for non-insurance, for not getting insurance, isn't felt until April 15th of 2015. And so we actually have another enrollment period that starts November 15th for the 2015 year. So there'll be 2 enrollment periods come and gone before anybody actually feels the penalty.
Very interesting. Thank you so much for being here today. Appreciate your time.
I'm glad to be here. Thank you.